What is the primary purpose of a Notice of Privacy Practices, NPP, in a healthcare setting? A. To outline treatment plans. B. To allow payment collection. C. To inform patients about HIPAA rights. D. To authorize prescription refills. Answer, C. The NPP explains how patient health information may be used and shared, and outlines patients' rights under HIPAA. When a patient is referred to a specialist, what documentation must the CMAA send? A. Laboratory results only. B. Entire medical chart. C. Referral form and relevant medical records. D. Billing statement. Answer, C. Referral to a specialist requires documentation that includes the referral form and any related medical records to assist the specialist in care. Which of the following is the most secure method for sending medical records? A. Email without encryption. B. Postal mail. C. Fax with cover sheet. D. Hand delivery. Answer, D. While faxing with a cover sheet is commonly used, hand delivery is the most secure as it avoids interception and ensures privacy. Which of the following terms describes the legal document that allows someone to make healthcare decisions for a patient? A. Living will. B. Advance directive. C. Durable power of attorney for healthcare. D. HIPAA release form. Answer, C. A durable power of attorney for healthcare designates someone to make medical decisions if the patient is incapacitated. A CMAA is scheduling a patient for a cardiac stress test. Which department is responsible for performing this? A. Radiology. B. Cardiology. C. Hematology. D. Pulmonology. Answer, B. Cardiac stress tests are conducted by the cardiology department, which specializes in heart conditions. What is the appropriate action if a patient refuses treatment due to religious beliefs? A. Inform security. B. Insist on the treatment. C. Document the refusal in the medical record. D. Schedule another appointment. Answer, C. Patients have the right to refuse treatment. The CMAA must document the refusal and notify the provider. Which coding system is used to document outpatient procedures for insurance claims? A. ICD-10-CM. B. HCPCS Level 2. C. CPT. D. DSM-5. Answer, C. CPT, current procedural terminology, codes are used for documenting outpatient medical procedures and services. Which of the following forms must a new patient complete before their first appointment? A. Discharge summary. B. Laboratory requisition. C. Patient registration form. D. Surgical consent. Answer, C. The patient registration form collects demographic and insurance information necessary to create the medical record. A patient is angry and begins yelling at the front desk. What should the CMAA do first? A. Call 911. B. Match the patient's tone. C. Remain calm and listen. D. Ask them to leave. Answer, C. Staying calm and listening can de-escalate the situation and allow the CMAA to resolve the issue professionally. Which organization ensures workplace safety for healthcare staff? A. FDA. B. CDC. C. OSHA. D. HHS. Answer, C. OSHA, Occupational Safety and Health Administration, regulates and enforces workplace safety standards. What is the best way to verify a patient's insurance coverage during check-in? A. Ask the patient if their insurance is active. B. Check the expiration date on their card. C. Contact the insurance company. D. Ask for a copay. Answer, C. Verification through the insurance company confirms the patient's eligibility and coverage. What is the purpose of assigning a CPT modifier to a procedure code? A. To increase reimbursement. B. To indicate a change in procedure circumstances. C. To replace a denied code. D. To report patient demographics. Answer, B. Modifiers provide additional information about the performed procedure, such as multiple locations or complexity. What should be done if a claim is denied for a coding error? A. Submit a new patient registration. B. Resubmit the corrected claim. C. Ignore the denial. D. Request a prior authorization. Answer, B. The proper course of action is to correct the coding error and resubmit the claim for processing. Which action demonstrates compliance with the ADA in a medical office? A. Providing medical forms in multiple languages. B. Having a ramp at the entrance. C. Offering free parking. D. Accepting all insurance plans. Answer, B. ADA, Americans with Disabilities Act, requires accessible entryways, like ramps, for disabled individuals. How should a CMAA handle a billing inquiry they cannot answer? A. Make up an answer. B. Refer to the billing department. C. Ignore the question. D. Ask the patient to leave. Answer, B. CMAAs should refer patients to the appropriate department when questions fall outside their knowledge or scope. A patient calls to cancel their appointment. What should the CMAA do? A. Hang up and delete the appointment. B. Tell the provider immediately. C. Cancel the appointment and offer to reschedule. D. Document it but don't inform anyone. Answer, C. Appointments should be canceled in the system, documented, and the patient should be offered another time slot. Which of the following is used to determine how long records must be kept? A. HIPAA. B. OSHA. C. State law. D. Medicare. Answer, C. Record retention is governed by state law, which may vary by location and patient age. When should the CMAA collect the patient's copayment? A. After claim is approved. B. After the provider signs off. C. Before the service. D. After patient leaves. Answer, C. Copays are collected at check-in to ensure payment for services rendered. What is the term for sending patients to another provider for specialized care? A. Pre-certification. B. Consultation. C. Referral. D. Coding. Answer, C. A referral is the formal process of directing a patient to a specialist. Which of the following best describes an explanation of benefits, EOB? A. A payment request. B. A document explaining insurance payments. C. A medical diagnosis sheet. D. A prescription summary. Answer, B. An EOB details how the insurance company processed a claim, including payment and patient responsibility. What is the correct action when a CMAA suspects fraud in a billing statement? A. Ignore it. B. Report to the office manager. C. Bill the patient anyway. D. Submit the claim. Answer, B. Suspected fraud must be reported to supervisory staff for appropriate investigation and action. Which of these actions is a violation of patient confidentiality? A. Faxing records with a cover sheet. B. Leaving a message with test results. C. Calling out full names in a waiting room. D. Discussing billing in private. Answer, C. Publicly announcing patient names can be a HIPAA violation if not necessary or consented to. A provider wants to see a patient every 6 months. What type of appointment is this? A. Follow-up. B. Emergency. C. Walk-in. D. Same day. Answer, A. A follow-up is a scheduled return visit to monitor progress or results of treatment. Which of the following defines the scope of practice for CMAAs? A. HIPAA guidelines. B. Federal labor laws. C. State medical board regulations. D. Provider preference. Answer, C. The scope of practice for CMAAs is defined by each state's medical board and applicable regulations. What is the purpose of an encounter form? A. To schedule a follow-up. B. To update insurance info. C. To document services for billing. D. To consent to treatment. Answer: C. Encounter forms list services and diagnoses, facilitating billing and coding after a visit. Which form is used to authorize insurance payments directly to the provider? A. CMS 1500. B. Assignment of benefits. C. HIPAA consent. D. Release of information. Answer: B. The assignment of benefits form authorizes the insurer to send payments directly to the provider. What does a CMAA do when an established patient arrives without a scheduled appointment? A. Deny service. B. Refer to another facility. C. Inform provider and ask if they can be seen. D. Ignore them. Answer: C. The CMAA should notify the provider to determine if the patient can be accommodated. What is the first step in processing incoming mail in a medical office? A. Scan and shred. B. Stamp and file. C. Sort and open. D. Forward to insurance. Answer: C. Sorting and opening mail is the initial step to ensure timely distribution of correspondence. A CMAA notices a patient is confused about their diagnosis paperwork. What should the CMAA do? A. Interpret the medical terms. B. Refer to the provider. C. Tell them to look it up online. D. Ignore the concern. Answer: B. Only the provider should explain diagnosis-related content. The CMAA should refer the patient accordingly. Which scheduling strategy groups similar types of patients together during specific blocks of time? A. Wave scheduling. B. Open hour scheduling. C. Cluster scheduling. D. Double booking. Answer: C. Cluster scheduling improves efficiency by grouping patients with similar needs in the same time slots.